I'm Dr. Michelle Hucke with Jack's Beaches Family Dentistry here in Neptune Beach. I've been a dentist for 30 years. I've been here in Jacksonville Beach since 2014. Before that, I worked with my husband in St. Augustine, and before that, I had the pleasure of working with my dad in my hometown. Yeah, I've always been passionate about health and wellness and always have felt like the mouth is the window to the rest of your body and to your overall health. When I went to dental school, the main thing we learned was, you cleaned the debris with a scaling off of your teeth, and then you explained to people how to floss. And then every time they came in and they weren't flossing, you told them they needed to floss. That's the thing with flossing too. It's like, it's not fun. And there's no immediate gratification. With Perio Trays, it feels good. It makes your mouth feel amazing. Your breath is amazing. And it's great because it's a custom tray that has a gasket in it that goes all the way around the tray. And the gel goes in here. It's custom made from a scan of your teeth. And the gel is trapped in there. So it's like a hyperbaric chamber. And what I tell patients is that the bad bacteria doesn't like oxygen. So it oxygenates your entire mouth and it turns your mouth into a completely different community. So it used to be a bad community with bad bacteria. And when you put oxygen in the environment, the bad bacteria can't survive. They don't like oxygen. So it completely transforms your mouth, which is much different than scaling and root planing that just moves the bacteria around and then they just regrow exactly how they were. Yeah, we drew a line in the sand a long time ago, and we incorporate the Perio trays as part of the scaling and root planing procedure. One of the things about periodontal disease that's interesting is that a lot of times there's no symptoms. So people are walking around and they haven't been to the dentist in 5 to 10 years, and they talk about how they've never had a cavity and everything's great and they don't need to go to the dentist because everything's fine. And those patients are usually periodontal patients. They don't have a tendency to get cavities and they have a symptomless disease. Your mouth is connected to the rest of your body. The one disease I think that everyone can agree on is diabetes. Even when I was in dental school, we talked about the link between diabetes and gum disease. When you have gum disease, it is almost impossible to control your sugar. I like doing things one time and having them last for decades. And the best way to do that is to focus on health and figure out why is there bleeding? Where is the bacteria coming from? How can we actually get rid of it and keep the person healthy?